This is Frank Islam, Chairman and CEO of FI Investment Group and your host of Washington Calling, where we interview leading voices from business, politics that impact you, the viewer. Today, we are fortunate to have a distinguished guest. His name is Dr. Jonnalagadda, also known to his friend as Dr. S. Jonna. He is the 37th president of the American Association of Physicians of Indian Origin, which is also known as AAPI. The AAPI has 80,000 doctors as its member. He practices in the state of Georgia. His organization has been doing a fantastic, commendable job in raising relief funds and dispatching life-saving medical supplies to India. We deeply appreciate his organization's help and support and generosity as India battles a very dangerous and deadly pandemic. So thank you for coming to our show and welcome to our show. And thank you for your great leadership and taking steps in helping India fight the pandemic. The situation in India is greatly concerning and alarming and heartbreaking, as we have watched with horror, as Indians do not have oxygen to breathe and lack of beds in the hospital. So I want to start the conversation. Please tell our global audience, how do you, the largest fraternity of doctors outside of India, view the health crisis in India at a moment? And can you tell us a roadmap to control the COVID-19, and how do you go about managing the future waves of the pandemic?
Yeah, first of all, good morning, and thank you, Frank, having me today. And my name is Dr. Sudhakar Jonnalagadda, as Mr. Frank mentioned. I'm the current president of National AAPI, representing interest of 100,000 physicians, the largest ethnic organization in the US and the second largest physician organization after AMA, American Medical Association. 1 in 6 patients in this country taken care by a physician of Indian origin. You can imagine how strong we are in the States. Having said that, AAPI was established 40 years ago and grown tremendously strength organization in the forefront in the medical and also community services. Okay, since first wave US started, and we did very well first wave. We supported a lot of hospitals, donating some PPE and educating the physicians here and also back home, including Australia, New Zealand, and India. We did global webinars and teaching friends, physicians, to see how to take care of this infection, because we don't know how to take care of infection in the beginning. Came into the picture, okay, emerged from Wuhan, and we are learning day to day how to handle this deadly infection. And in the beginning, AAPI was the forefront, telling the medical community that plasma therapy is something we should try. And of course, now it's not very important. And also steroids, or everybody, Italy, Spanish physicians, they're kind of concerned not using steroids at the time, but we put our foot down and tell them steroids are going to help benefit this infection. So we also wrote a letter to the President Trump at the time, and also governors and the senators that the treatment should be good. And also we wrote to Prime Minister Modi that shut down the country at the time, okay, which he did actually. And unfortunately, the second wave is came up and difficult in time. We don't know whether the government did not plan well or community did not follow the guidelines. Okay, we should not blame the government because the infection was rampant now. Community, I've been to one of the function in India at the time, wedding, and in a Zoom conference actually in June, and everybody hanging around without any mask and social distance. I think we should blame ourselves before blame anybody. I think this is something the country totally dropped the ball, and unfortunately, infection went rampant, and we are suffering. All of the community in India, Indian community, friends, relatives, or family members got disease and infected. Everyone got infected. AAPI, the initiative in the beginning, where it request came from Indian consulate from Atlanta, which I live in Georgia, and within 2 weeks, AAPI members gave a donation of $4.5 million. And
fantastic. Thank you very much.
and we already shipped 1,000 oxygen concentrators to India, and has been distributed. We tried to use two NGOs. One is the Seva, one is Red Cross. And the first shipment went to Seva, and we are getting all the information, where it has been donated, everything. And I did a pretty good job, But again, there are a lot of areas called isolated areas where they are distributing mostly because they are the people oxygen rather than go to hospital. And so shipment ready to go, but this time we're going to use the Red Cross. And again, the problem here is mostly, see, we are raising the funds, we are buying equipment, and we are looking for shipping and distribution. It's too much for us to do because being I'm not working full time for the job. It's a part-time job, and it is something like a charity job we are doing. So we really expect some help from government point of view, so that we can be able to fasten the facilitation reach India, and also that helps a lot of people to come forward and donate more and more money. So that's very important from Indian counterpart to government. They should help us. To somebody, organization like us, want to ship anything to India. And also, Frank, AAPI Executive Committee approved $1.6 million to buy ventilators as well as the high flow oxygen, which is very important for the patient with the COVID-19. And we look at the hospitals entire country. Okay, not that I'm from Andhra Pradesh, I look for Andhra. No, we never do that. And we went with a grade level, actually. We Googled and talked to the National Hospital Association, and they gave us a list of hospitals where they are needy, number one, and also where this equipment can be used. See, we send a ventilator where there is no proper technician or a pulmonologist to operate this equipment. It's going to sit in the warehouse. So we particularly look at our team look at the hospitals which are really required, and they have a qualified person to operate. So we are going to order probably Monday. Actually, everything is straightened out. We had an EC meeting. We discussed about the hospitals, and we try to do what is the best possible. And also we are working. I wrote a letter to the consulate in so that we're looking for some kind of cargo plane coming from India, so that you can able to ship a lot of equipment to India in a short duration of time. Otherwise, waiting game is we need to do the best what is needed right now. Okay, rather than wait until things are getting better. At the time there's no point. People are dying every day, and this is the time. We need to help. What are the money? We have to spend money as needed because that's the time of the need. So those are things right in the limelight in the track.
Let me shift my gears and talk about how the AAPI do to help India, considering we're divided by distance and time, but we are connected by shared heritage and shared history and shared background. Please shed some bright lights on your organization's support to India, and do you have a blanket immunity and indemnification in terms of your help physician from the United States to India?
Right. What we are doing right now, apart from doing essential things, we are creating a platform, okay, a telehealth platform to, like we use about 3 platforms right now, where, the 1,000 physicians are working to interact with the physicians in India to communicate with their help. For example, a physician from a remote part of India, Chhattisgarh, they want some help with the critical care patient, okay, they can join the platform online and talk to our critical care expert who have a lot of experience taking a COVID patient. That's why we are communicating with them. Regarding a patient also, anybody in rural India need help, they can join and do the online. And, we can able to provide the physician who can speak that kind of language so that, they can communicate easily with them. So most of these patients, 95% of patients are mildly ill, but the problem is they'll get panic. Once they get infection, they get panic and they lose their moral strength. So through this platform, we can assure them that they can able to get treatment at home rather than go to hospital. And assurance is very important because of the psychological impact on them once you get infection. Okay. So this platform helping them every day. The hundreds of physicians, patients are joining, and also the physicians. So I think we should be able to do this platform until talking about third wave or fourth. I don't know, but these are we should look into that. I think the government should be able to liberalize, so that the physician from outside country can come and help India in this critical time, all the nurses. But there are some restrictions, Indian government has to, give a statement saying that, listen, the physicians want to help, there are issues about the malpractice, and also, they can be able to help, where the need is there, But we have so far, we wrote a letter to the Minister of Health, but we are not able to hear anything so far. Okay, so it's very important give assurance that India is a very critical country, because of current situation where patient get upset and abusing physicians, that's not the way. Unless they got some help from the government of India, assurance, also the Indian Medical Council registration is very important. Okay, online medical council registration. We are licensed in India when you finish a medical school, but we didn't go for a renewal because it's not necessary at the time. Okay, so during this pandemic, they should liberalize the registration from the medical council so everyone can participate and help motherland.
Has your interaction and engagement with Indian authorities in this regard has been responsive in taking your support and help from the Indian doctors abroad? And you said you did you talk to the health minister to make sure that he's on board?
No, we tried to reach him, but with one time, we were supposed to have already Zoom conference with him, but last minute, he canceled because he got busy. And I understand, he had a lot of things in his in the plate, poor guy. I feel for him.
You did mention about the e-consultation, which is the telehealth platforms, right? So the telehealth platform is facilitating interaction between US and Indian doctors?
Correct. That's correct, Frank. And we have 3 platforms where they can join anytime, okay, if you want to discuss with any critical patient. And our specialists can talk to interact with them, and we can discuss with the case by case and guide them which go.
Has that been very effective, doctor?
Very effective, yeah, very effective.
My question to you is, and you mentioned that in your as per our conversation, the second wave happened because, as we understand, the current Indian government took their eyes off the ball and becoming complacent and allowed socially and politically events to go on quickly, such as the festivals and also the rallies, as Dr. Fauci, who I know very well, suggested, ignoring the warning sign. What is your thoughts? Can you share some of your thoughts why this happened and what can be done to make sure this thing like doesn't happen again? Sure.
I did mention that, before you blame the government, blame yourself, okay? Because, the guidelines has been there, okay? Social distance and mask, hand washing. I don't think Indian citizens did not follow the guidelines, unlike here, okay? And here, most of them getting vaccinated, okay? But in India, when the government offer vaccination, they stay away from the vaccination because of the scared, because, vaccination can cause adverse effects, and, it can cause some complications, side effects, But a lot of people did not take it. And now they're running for vaccination, but there's no vaccine right now, unfortunately. I think, government ignored, when you look at the oxygen, I think, infrastructure was not adequately there to support the demand of patient need like oxygen, okay? Every hospital should equip with an oxygen plant, okay? Rather than waiting for different part of the country to transport oxygen, by means of vehicles or by means of, air shipping. Every hospital should capable to have their oxygen plant, okay? Then only they can able to survive in future, in second, third. This infection not going to go away, okay? They're going to hang around, okay? So we need to prepare for in future. So oxygen plants are very important, number 1. Number 2, medications, okay? Prepare the medication like drugs. Now they're talking about fungal infection, which is going to be very rapid.
Black fungus you're talking about, right?
Mucormycosis. And they're asking for amphotericin, which is an antifungal infection medication to help them. there now is a short of supply, and unfortunately, people are telling me, I don't know, I can't, don't quote me, but people are saying, there is a black market of these drug medications in India for supply. That's a terrible thing happening. Okay, this is the time you should help your fellow brothers, sisters, in the country, rather than jack up the price and make some profit. But I know it's a business mind. You should have humanity. Humanity is very important. Business is business, okay, but humanity is most important than business. So help. You should not do that. Help them whatever available to serve this country in a humanitarian way. And we are there. I'm getting requests every day. We need some which is antiviral medicine and amphotericin, and oxygen concentrate. Every day I get texts from different part of the countries, so they need some help. Well, we're doing our best. Again, this is a combined effort of organizations. And
how do you ensure, doctor, that your financial aid and the medical supply are distributed effectively in a manner that's effective? There's no favoritism, and it also gets to the people who needs the most and who doesn't have all the connection that the Indian government requires in some cases.
Yeah, well, that's a good question, because as far as I'm concerned, our AAPI committee, they decided, again, Frank, we have manpower in India, okay, to distribute, okay. We are all located here and we don't have manpower there. So we have to depend on NGOs, okay, the organization like Seva or Red Cross,
Okay.
So the first shipment, the committee decided to give to Seva because they're at the ground level. They know exactly where the needy place, okay, like isolated places and NGOs, okay. So we are getting, we are not able to get all those contractors where they're given, but I insist to them, for transparency, we need those areas has been distributed, and also the picture also, the evidence based, okay. I know that exactly has been delivered or not, okay. Trying to do, and I'm insisting them to give to, so that I can tell my members, okay, listen, this is the money has spent for this and has distributed in the various part of the country, okay. So, that is transparency very important. I request them, and they are doing their best also. Hopefully it will happen.
I hope so. And how do you ensure that the Indians are vaccinated? And can you shed some light on availability and accessibility of the vaccine, and how long it will take to get 1.2, 1.4 billion people vaccinated? And tell us the efforts in preventing the spread of the COVID-19. And you mentioned about the fact that black fungus is also spreading. Give us a little bit to highlight what needs to be done to step up the in terms of the vaccination for all the peoples. And there has been a lot of stories, as you probably know. You heard of that. The medical supply is not there. The factory was burned in some cases, and also the government just took off their eye from the balls, and they didn't do a good job in anticipating this deadly pandemic.
Yeah, it's a very good question, Frank. And it is a lot of effort. First of all, at this point, India is a hub for vaccination. They are the major hub for the vaccination. And has been shipped to Canada, has been shipped to Africa, has been shipped to Brazil when the first wave happened in India. But luckily India survived very well, with not much catastrophe, because we don't know exactly how that happened. Okay, because they did very well actually within a short duration of time, and the case rate went down, and at one point pretty much a dismal amount of cases has been reported the first wave. Okay. At the time, a lot of people did not take vaccinations, and now they're looking for vaccination, but we don't have vaccination.
Right.
So what we did, there are 60 million vaccinations lying in Washington, and AAPI wrote letters to the 100 senators so that
yes,
I'm
aware of that, and I was part of the discussion. Yeah. Right.
So we were able to talk to President Biden and Vice President Kamala Harris, so that they were able to send at least 40 million vaccination AstraZeneca to India immediately. Okay, and also AAPI, as a president, I had a meeting with Reverend Jesse Jackson, who is a civil rights leader.
Yeah, I know.
He's motivated, and met him in Atlanta. I had a long discussion with him that he's going to go. Actually, went this week. This coming week, actually, to go meet Mr. Biden. so that, help India to send the vaccinations, also medications, to help immediately. So I think, this is the time the two largest democracy in the country. I can say the strongest democracy should help the largest democracy. So this is the way we should help, and India need now. And vaccination, no question, we should ship immediately all the AstraZeneca vaccine to India to vaccinate 1.2 billion. And also, we need to talk to the Pfizer and Moderna so that they can have supply those vaccinations to India also, so that because one of the best vaccines available in this country. Mm-hmm. And also they're testing for these variants, okay, like variant of South Africa, variant of Brazil, variant of England, variant of India. They say some of them data showing that vaccines can protect these variants of Indian variants, okay, Moderna and Pfizer, which is available.
When do you think this campaign will be completed in order to get that many people vaccinated, and how quickly they can get, and how is the government's red tape is preventing in some cases to make this happen? And how do you go about making sure that not you, the government of India, obviously, they're the one who running
well, I think the most important thing, if you talk about 1.2 billion people get vaccinated completely, it is going to be 2025, okay, 2025. It's not
going. So it will take 3 years?
Yes, at least 3 years, okay. Because the production has to improve the production. And you give, like a Sputnik has been approved in India, and they had J&J vaccine also approved in India. So, they had to double, not triple the production, to vaccinate all the Indian subcontinent. And most important thing, in order to take out the fear of vaccination to our common man, okay?
That's a good point you made.
The most important, we had to use physicians and celebrities, okay, tell them that I got vaccinated, I'm fine. So you take it, you stay safe, okay. That slogan definitely will reach the common man, okay, because they listen to these people more than any of us, okay. So the celebrities and the local physicians in the country and also in the state and district-wise, they should be able to promote and educate the community, take vaccines safe and get better. I think that's the way to go, actually, because people listen to that kind of information.
How does the Indian government can have a campaign to ensure the hesitancy of the vaccine to make sure everybody gets the vaccination in addition to the people who are the common people, as you said, who are the stars, who people will listen. They're not going to listen me and you. Yeah. How did the Indian government can take some kind of a campaign to make sure this happens?
I think the best, you media, okay? Media is the best powerful, the pen is the mightier than sword, okay? You guys make a difference, okay? You should tell them, television ads, okay, and paper ads that, vaccine is safe, take it, and the bottom line, the production has to be triple the production in India, and so that, we can be able to vaccinate all the brothers and sisters in India to protect these people from the deadly virus. And definitely the safety and important to tell the patients, they're safe, and, so that, the hesitancy of taking vaccine will go away.
Well, I was talking to Tony Blair about last week, and he started a campaign. He also mentioned that we need to show some of these statistics that if you are fully vaccinated, then you're not dead, you're not dying, and it's very important for you to be safe, to make sure other people are safe. But the campaign has to come from the government and the stars and the people who you said, the people who basically will listen to that. So, and the media will play an important role. But how come media is not doing their job in India?
Well, I don't know. I'm not a media person.
I do not know either. I don't live there.
Yeah, definitely. You are well said. People get vaccinated. The chance of dying with infection is much low compared to a person who is not vaccinated. Okay, even there is no zero risk. People get vaccinated also get infection. Okay, they can get infection, but the chances of severe infection is much less, and chances of going to ICU is much less. Chance of going to respiratory is much less. There are one or two cases are there because of the bad comorbid conditions, but but most of the time, they'll survive, not going to severely sick. So I think it's good to say even the pregnant lady should take vaccine. Okay, that's what the data is showing.
Why don't Prime Minister Modi start the campaign himself? Because he got millions and millions of followers on from his BJP government, and he needs to say, I'm in this with you together, and together we can help shape a better future if you take the vaccine, and we'll make sure we'll make it available. He seems to be, no, I do not know, but according to the Boston Globe, he seems to be very hesitant on this.
Yeah, I think that's good. Actually, Prime Minister Modi is a very popular man and a well-respected man in the entire world. Actually, his word takes a long day. Okay, I think you should. I think I'm sure he's going to come out and promote vaccination. He should do it, I think, as a Prime Minister.
So before we close our conversation, do you have any other thoughts that you want to share with our audience? And we deeply appreciate all you're doing to make a meaningful and profound difference in people's lives in India and around the world, what you're doing.
Well, I think as president of AAPI, my message, AAPI is there for motherland. We are there to support whatever we could. We do our best to send them all the equipment, medications, and also educate the physicians in India through these platforms, if they need help. And we want to come down and help you, India, but because of the restrictions has to be lifted so that it will come, and the process should be streamlined so that more physicians will participate to help the motherland. And most important thing, take vaccine. And even though you take vaccine, you still use the mask and hand wash and social distance, very important, until we get a proper medication to treat this infection. Until then, you have to be very careful, stay safe, and I'm sure India is a great country. It pulled through several problems like this. We'll pull through it, and with the help of the community and the leaders, and I'm sure who's the light, you see the light. So thanks for having me today.
Yeah, you're most welcome, and thank you for watching. This is Frank Islam wishing you a great week.